what is trending? Paracetamol and autism. I mean, I was surprised when I just saw paracetamol and autism. I'm like, well, I overlooked it like one of all those funny things you see on the internet. Only for me to look again and see that, oh, this was coming from the United States.
The US.
The US is one of the most controversial countries in the world. It may be the most, and currently they have a very controversial president. Now, many of us in Nigeria.
Sometimes it makes sense. Sometimes.
Yes. So you know the funny thing about Nigeria. Of course, Nigerians too are interesting. Many times we support some of the things that Trump says about some of the things he says, but once it comes to Nigeria, you begin to say, "Oh, why is he behaving like this? Why is he deporting you like that?" You know. But the truth about it, let's not mince words. Trump is controversial.
Yeah.
Meaning that not everything he says is correct, and not everything he says is false. So we have to examine each thing he says. We don't have to say, well, because it came from Trump, it has to be false, and because it came from Trump, it has to be true. Now, Trump and the FDA boss came out with this statement saying that paracetamol causes autism.
Don't take Tylenol. There's no downside. Don't take it. You'll be uncomfortable. It won't be as easy, maybe, but don't take it. If you're pregnant, don't take Tylenol. And don't give it to the baby after the baby is born.
I mean, we need to examine that. What is the truth about it? So, I think to answer...
Is that an expert opinion? What opinion are we going to call that?
Yeah, because I always say that if you are not an expert, especially in medical things, you can't come out on your pulpit or on the platform and say some things, because you know many people follow you.
Yeah.
So if a politician or a clergy comes out to say things, in fact, most times the politicians and clergy have more following than doctors. Yes, if you are the head of a church that has a population of I don't know, maybe 1 million members, of course, if you speak, people are going to follow you. But as a doctor, you may not be able to gather more than how many people at a time? Maybe 50 people at a time.
Exactly.
So those are influential.
Well, they're influential doctors now.
No, they're influential doctors online. Yes.
Online.
For the interesting thing about it is that it seems as if the more knowledge you have, the less influential you are. Anyway, let's leave
that for another time.
So now we are going to examine it. You know, on this channel, we don't run away from things that may be controversial, and we will give you answers. We will give you the right answer. So what is autism to start with?
Well, when you talk about autism, it's not just one thing. It's a group of disorders, or sometimes you call it autistic spectrum disorder, because it's not just one thing. It's a spectrum of neurological or developmental disorders that affect certain things: behavior, social interaction, intelligence, activities, and all of that. And you can have someone who is hyperactive. You can have someone who doesn't want to interact with people. I'm just trying to break it down in ways people can
very
understand.
Simple now, very
so someone may not just be able to, communicate, language and communication, expression, and all of that. So it varies in its affectation. Simply put, that is what it is. A neurodevelopmental disorder.
Neurodevelopmental disorder.
Yes.
Clear. Okay. So the question is, what causes autism?
There are so many things that you can't pinpoint it to.
Exactly, that's the point I was going to make.
Genetic predisposition, environmental factors, several environmental factors.
So how would you come to a conclusion that one drug causes autism? That is wrong. I know that even in the past, people have said vaccines cause autism.
Vaccines.
Yes, people have said that, but
But I understand the people want answers. The diagnosis of autism these days is increasing, so people want to pin it to something that this is what is causing it, and which is we want to know why is this happening, what is causing this,
Yeah. So in the quest for finding a culprit, should we then come up and say anything? So in medical practice, what is not about how we feel. Even if you listen to Trump, he says I feel. Many times he was saying I feel. You don't feel.
It's not about feeling.
You don't
I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. Is that a correct statement, by the way? See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with it.
There's hierarchy of evidence when we talk about research. There are certain types of study types that you will do that you will not be able to say that this has caused this.
Yeah.
You can infer from such researches that this causes this. But in medicine, there's hierarchy of evidence. You can't just come out to say, I feel, it doesn't make sense.
By the way, do watch this video till the end, because at the end of this video, we are going to give you the final answer, what you should run with. So don't just skip this video. All right. Now, like we've already said, if you are not a doctor, don't come out to make categorical statements about people's health. And not only that, it's not only about being a doctor, it's about you make sure you have actually examined very well the evidence that we have. A lot of those things happened during COVID. COVID, it made it very
Everybody
clear.
became an expert in medicine.
The problem with COVID was that people who did not know anything about medicine started talking about medicine.
Yeah.
Meanwhile, people who are supposed to be experts in medicine became political. So you had people, I don't want to mention anybody's name, but you had people who are experts in medicine. They became partisan. So you begin to support a political movement or support the president. Once you do that, you will no longer be sincere. When you are supposed to say no, there's no evidence for use of hydroxychloroquine, you will say everybody should use hydroxychloroquine. So remember that even Kamala Harris, I shouldn't have, but it doesn't matter. She initially said she was never going to take that vaccine. I mean, how can you come out, someone that everybody respects says, no, I'm never going to take the vaccine, but a few months down the line, she took the vaccine?
People like that now. Some people even didn't believe that there was COVID.
Yeah, people didn't believe there was COVID, yeah.
But we knew people that died.
Said there was no COVID. It's very interesting. It's very interesting. It's just like you saying that there are no sick people don't exist. You can actually say sick people don't exist because you walk on the street and you don't see
because
sick
it
people
didn't affect
on
you
the
now.
streets.
Because it didn't people died affected you.
So you come out and say funny things like
existed,
that. Anyway,
and it's still existing. It's just that it's under control.
Yeah, there's also something interesting that came to my mind when I was thinking about paracetamol and autism. I said, what if I come out now and say crossing the express causes pregnant women to lose their pregnancies?
Makes sense. Because when you are crossing the express, you can run. The fear of a car is coming, and then the woman loses the pregnancy. Will you now say it's the crossing of the road that's caused the loss of the pregnancy?
That is just what it is. That is just what it is.
I think that's a near perfect analogy for this thing.
Yes. So that's very good analogy, Ron. So we are now going to break it down so that you can understand. This is it. Why would a pregnant woman use paracetamol in pregnancy?
There are two main things. Whether they have pain or fever.
Yes, pain and fever.
Things that would cause pain, things that would cause fever.
So meanwhile, we already know scientifically that fever and things that cause fever will increase the chances of a child developing neurodevelopmental problems.
Viral infections, several viral infections, bacterial infections, whatever infection.
Yes. So,
or whatever it is.
Now, when you are doing the research, it means you should have removed those confounders.
Exactly. In research, you talk about confounders, things that would affect your result, that can cause the same thing as what you're looking at that to affect your result, and you account for them in your research.
Yes. So you cannot say that a woman has a particular illness that will cause neurodevelopmental problems and uses paracetamol. You now pick the paracetamol as the cause
Why
the
don't
problem.
you look back at the problem? So what are the things causing this fever in the first place?
Yeah.
Are those not the things we should be looking at instead of the paracetamol? Why not, is that not our research?
That's what it's supposed to be. Now, let's go a step further. We are talking about research here, so it means research has been done.
Yeah.
Now, there was a Swedish study that looked at, because this thing is not just it didn't happen just this year. For a few years now, there's been some caution, to medical practitioners about using paracetamol in pregnancy. There was a Swedish study that looked at it, relationship between paracetamol and autism, and they said there was no link. There was no causal link.
Right. What type of study was it? Was it a randomized?
It was a randomized control trial. Yes,
okay.
It was a randomized control trial. And this study that they are talking about, because what Trump and the FDA boss are talking about are actually based on a particular study.
I'll tell you, the biggest study was done by Harvard and Mount Sinai. They looked at 27 studies showing an association. There were 4 against it, and they said, based on the overwhelming body of evidence, there was a causal relationship. Those are the exact words of the dean of the Harvard School of Public Health.
Now, that study was carried out in the US. And it is clearly stated there. So when you are wondering, when they just looked through the study, found some statements that say, there's a link, but they didn't look at the results and the conclusion, which states that more studies need to be done for you to be able to make that statement
categorically. And then you need to now study the illnesses.
Yes.
The illnesses for which paracetamol is used. That paracetamol is used for.
I've said Trump is controversial. RFK Jr. himself is controversial. You remember that this was the same person that he was the first person to talk about autism and vaccines.
Yeah.
There was a time he said, if you look at, there are many videos of RFK Jr. There's a time he said, if you could, of course, all his children were vaccinated. I think, is it 6 children? They were vaccinated. But they asked him some years, after a few years, that if he could go back in time, would he refuse to vaccinate his children? He said yes. After a few years again, he said no. He appeared before Congress and he said he was not anti-vaccine. Meanwhile, there are videos that have said he's anti-vaccine.
Yeah, how can he be inconsistent? So
he's the kind of person that says you have mercury in vaccines, and those are the things that cause autism. Mercury has been removed from vaccines long ago. When? And this time, Marisol, they are talking about that they removed from these vaccines. After removing that from the vaccines, autism rates have actually gone up. So if that was the cause, autism rates should have dropped.
But people would ask, why is it that autism rates or ASD has gone up, really? Before now, our lifestyle has changed. We talk about genetic predisposition, and in fact there's also the effect of epigenetics, the epigenetic aspect of it, our lifestyle, environmental factors affecting genes, causing alterations in genes that will now lead to predisposition to the development of these neurodevelopmental disorders. So a combination of genetic factors, environmental factors, toxins that we were not exposed to before, people are being exposed to them. And we even now know that it goes beyond what a woman is exposed to during pregnancy. In fact, what a woman was exposed to, or how a woman or a man led their lives before making a child, has impact on the development of that child, if you understand what I mean. So it's not until you even become pregnant and you get, so the things that we're exposed to right now are affecting us. Also, the fact that there's now more enlightenment about autism, so we are likely to pick more children who have autism, and those are the reasons that have been given why we have more prevalence and incidents of autism.
Yeah, because a child could have been autistic in
Exactly.
the past, and you will not even say he's autistic. You just say he's dumb. He's
yes,
retarded.
there were people we knew, or I knew when I was growing up. I didn't know anything about autism. I just be wondering, why is this child behaving like this? Why is this person behaving like this? But now we know better that such people, in retrospect, maybe that person had autism.
Now, what is the conclusion of this? The conclusion is that paracetamol has not been shown to cause autism. Now, if you have as a matter of fact, the Society for the Obstetricians and Gynecologists, paracetamol is actually the safest.
That's what we give pregnant.
That's what you give pregnant women.
But that's not to say because something is safe for use in pregnancy, you now abuse it.
So that is the point. The point here is, if a drug is not required, not only paracetamol, you don't use drugs that you don't need.
So, for example, when I consult with pregnant women, you see, I have my routine drugs, and some pregnant women will actually mention, my folic acid, my iron, and paracetamol. I tell them paracetamol is not a routine drug.
Exactly.
It's not a routine drug in pregnancy.
It's not a routine
drug.
It's
not a routine drug in pregnancy. There's reasons why we give you paracetamol to use. Okay.
Paracetamol is not a routine drug. Whether you are pregnant or not, you don't just have to say every night I use paracetamol.
There's some people that every night I use
this drug.
No, it doesn't go that way. It doesn't work that way.
Actually, that paper we are talking about talked about, there are some timelines to what they were discussing. They were, in fact, they said prolonged use of paracetamol for usually more than 4 weeks.
Imagine that.
In fact, they stated it.
Who uses anyway? Okay.
Yeah, because nobody
and we're pregnant.
And we're pregnant. People are pregnant and they just feel, a pregnant woman just feels I'm tired. I have pain. I just use paracetamol. Pain. No, that's not what paracetamol is for. So the thing here is, if you are pregnant, we are concentrating on pregnant women now. If you are pregnant, do not use any drug without consulting your doctor.
Exactly.
Use every drug that your doctor has prescribed according to prescription.
Exactly.
Once what they are treating you for has been taken care of, you no longer need to use the drug.
I usually, for example, when people have, let's say, an infective process and you write paracetamol for 3 days, I usually tell my patient, irrespective of that, I have written this medication for 3 days. Doesn't mean you have to use it for 3 days. Yeah. Immediately you found relief.
Yeah.
Stop it.
Yes.
So the fact that someone has even written it for 3 days, paracetamol now. As soon as the symptoms have abated, you can stop it. Doesn't mean you have to continue to use it.
Note of caution: you use the drug for the shortest duration.
Possible.
Now, you shouldn't say that because you've heard that paracetamol causes this thing. So when you have fever, you now say no. And Trump actually said it. He said it will just give you a bit more of discomfort. You can bear it. He was saying, making statements like that.
There's no downside. Don't take it. You'll be uncomfortable. It won't be as easy, maybe, but don't take it. If you're pregnant, don't take Tylenol.
So if a pregnant woman should have a urinary tract infection or malaria in pregnancy, they say I shouldn't use paracetamol, so I will just bear it. My sister, don't bear it. You are destroying that baby, or sometimes the baby you might even lose the baby.
Exactly.
That fever is dangerous.
Yeah. So
that is the note of caution. Doctors should not say that now we found the cause of autism, let's go and sleep. It's paracetamol.
No.
That's interesting. So I believe
this kind of things just makes people major on the minor. The things that we should be talking about: environmental toxins, the food that people are eating, toxins here and there, our exposures here and there, chemicals here and there that we are being exposed to. Well, that's not to say drugs are not medications are not chemicals, but you know, I usually say that when medications, pharmaceuticals are prescribed, you want to weigh the risk versus
the
benefits. If the benefit outweighs the risk,
then
because every medication actually is a potential poison. Yeah, I usually say that. But if the risk of not using that medication outweighs the benefit, then don't use it. But if the benefit outweighs the risk, then you need to use it.
Yeah. So I think that's the conclusion. Please use paracetamol when your doctor prescribes it. Do not
abuse it,
and do not say you're not going to use it because you heard something that is not correct. So,
and if you decide not to use it, then be ready to bear it and bear the consequences.
Yeah. I know you have comments. Let's make it interactive. Drop your comments, drop your questions, and we're going to answer them. Catch you next time.
Bye.
Bye.